Each year, cardiovascular diseases claim more lives than any other cause. They're also responsible for numerous disabilities and a significant decline in quality of life. Alarmingly, we're seeing heart diseases start at increasingly younger ages, largely due to poor lifestyle habits and inadequate preventive measures. Disclaimer: the information provided in this video is for educational purposes only and is not intended as a substitute for professional medical advice. While we're familiar with common cardiac risk factors like diabetes, obesity, high-fat diets, sedentary lifestyles, and smoking, there's another often overlooked factor: certain frequently used medications. Did you know that some common medications can worsen cardiovascular disease? Are you aware which medications might be affecting your heart? You might be surprised by some of them. If you want to learn more about this crucial topic, stay tuned as we explore the potential negative impacts of certain medications on heart health. Heart failure, one of the most commonly diagnosed serious conditions after age 65, is a long-term consequence of many cardiovascular diseases. It's characterized by a weakening or failure of the heart muscle, manifesting in various clinical ways. Heart failure is a leading cause of hospitalizations for those over 65, resulting in significant expenses for insurance companies and governments managing the associated complications. In many cases, heart failure requires extended and costly hospital stays. Epidemiological studies have shown that the proper use of medication significantly reduces the number and duration of hospitalizations, especially for patients managing multiple treatments for several simultaneous diseases. This is particularly important for elderly individuals, who often have up to 4 or 5 chronic conditions requiring careful medication management. Heart failure is frequently associated with other chronic conditions like osteoarthritis, chronic kidney disease, diabetes mellitus, hypothyroidism, and obesity. Additionally, chronic respiratory issues, such as chronic obstructive pulmonary disease, COPD, and emphysema, often linked to smoking in earlier years, are common. As a result, many patients with heart failure are prescribed multiple medications. Research indicates that patients with 5 or more chronic diseases average 14 medical visits per year, compared to just 1 or 2 visits for those with only heart disease. Most of these visits are due to adverse effects or interactions between medications. The complexity of managing multiple chronic diseases and medications increases the likelihood of complications. For instance, a scientific study found that patients taking 2 additional medications, besides those for heart failure, have a 133% higher risk of experiencing a drug interaction. This risk continues to rise with the number of prescribed medications. The risk of heart damage increases, and it jumps to 82% when more than 7 medications are involved. In this video, we'll discuss 7 medications that could harm your heart. But before we dive in, don't forget to subscribe to the channel, like the video, and stick around until the end because the information we're covering is crucial. Let's get started. Number 1. Nasal decongestants. One of the medications known to impact heart health is the nasal decongestant. These are often sold over the counter and may contain various components. The most common one is pseudoephedrine, which has been used less frequently due to its cardiovascular effects. However, it's still available on its own or combined with other drugs. Pseudoephedrine, along with phenylephrine, can increase blood pressure and heart rate, raising the risk of arrhythmias and potentially leading to the decompensation of previously stable heart failure. Even when used topically as drops, nasal decongestants can have cardiac effects. Nasal decongestants are primarily used for common colds or allergic rhinitis. Since their effects are short-lived, people often use them repeatedly throughout the day, heightening the risk of adverse cardiovascular effects. The way decongestants work is by causing vasoconstriction, or the narrowing of blood vessels, in the nasal mucosa and sinuses. This reduces swelling and the drainage of mucus, which together lead to nasal congestion. While pseudoephedrine and other nasal decongestants have direct cardiovascular effects, the doses commonly used are typically low, making them generally safe when used at recommended levels for short periods, as long as there is no underlying heart disease. Nowadays, there are alternatives available, such as saline solution-based nasal sprays and anti-allergics, which do not directly affect the cardiovascular system and are safe for most patients. Number 2. Non-steroidal anti-inflammatory drugs, NSAIDs. NSAIDs include medications like diclofenac, ibuprofen, indomethacin, ketoprofen, and naproxen, among others. These drugs are widely used and, in most countries, can be purchased without a prescription. They are commonly taken to relieve pain, reduce inflammation, and lower fever. However, what many people don't realize is that NSAIDs come with a range of adverse effects, including potential cardiovascular risks. These medications can impact several organs, including the kidneys and digestive system. Numerous studies have shown that NSAIDs can lead to increased blood pressure and a higher risk of heart failure. This is because they can cause sodium and water retention and reduce the production of prostacyclin, a natural vasodilator. As a result, the risk of elevated blood pressure is a significant side effect of these medications. This effect is observed with all NSAIDs except for low-dose aspirin. The inhibition of vasodilatory substances like prostaglandins in the kidneys reduces the filtration rate, leading to sodium and water retention. These effects can decompensate a patient with existing dilated cardiomyopathy. Among NSAIDs, ibuprofen is the most commonly used by the general population. Studies have shown that heart failure patients decompensate up to twice as much when taking anti-inflammatory drugs, especially those who are also on diuretics. This decompensation can occur within just a few days of starting NSAID treatment. Furthermore, there is an increase in hospitalizations and longer hospital stays for people with dilated cardiomyopathy or heart failure when they use anti-inflammatory drugs. This highlights the importance of avoiding NSAIDs like ibuprofen for individuals with pre-existing cardiovascular issues, particularly those taking medications such as diuretics or certain types of antihypertensives like enalapril or captopril. Scientists estimate that NSAID consumption could be responsible for 20% of newly diagnosed cases of congestive heart failure decompensation. Number 3. Diabetes medications. Diabetes mellitus is increasingly common and often coexists with chronic cardiovascular problems. It's not uncommon to find patients who are on medications for both heart issues and diabetes. Diabetes treatment, alongside diet, lifestyle habits, and physical activity, often involves the correct use of medication. In some cases, treatment includes daily insulin injections, calculated based on the patient's weight, activity level, and requirements. However, diabetes can often be managed with oral medications known as hypoglycemics. Unfortunately, some of these hypoglycemics have been linked to a deterioration in heart function. Medications for diabetes should always be prescribed and monitored under strict medical supervision. It's crucial never to alter the dose or combine these medications with others without your doctor's approval. Among the most commonly used diabetes medications are thiazolidinediones, such as pioglitazone and rosiglitazone. These drugs have been shown to cause fluid retention and even weight gain, which can worsen symptoms in patients with diagnosed heart failure, increase the likelihood of cardiac symptoms, and raise the probability of hospitalizations. Another group of diabetes medications, DPP-4 inhibitors, includes drugs like alogliptin, linagliptin, saxagliptin, and sitagliptin. While the exact mechanism by which these drugs may worsen heart failure is still unknown, some medical reports have indicated that using these medications in patients with chronic heart conditions can exacerbate heart failure symptoms. On the other hand, metformin, a widely used medication for type 2 diabetes, might help reduce the risk of heart failure. A comprehensive analysis of over 200 scientific studies involving more than 1.4 million people using metformin found that this drug can decrease the risk of heart disease complications or directly reduce cardiovascular mortality by 30 to 40% compared to other diabetes medications. The study evaluated approximately 12 different diabetes drugs and concluded that metformin was the only one that significantly improved the cardiovascular profile of diabetic patients. Despite these promising results, the effects of these medications are still being studied. While metformin has a beneficial impact on heart health, it is not suitable for all type 2 diabetics because its direct effect on lowering blood glucose may require additional medications for comprehensive diabetes control. All medications used for type 2 diabetes, including Metformin, have gastrointestinal and metabolic effects, so choosing the right medication and dosage must be carefully evaluated by your doctor on an individual basis. However, Metformin has proven to be safe not only for heart failure and cardiovascular diseases, but also for improving life expectancy and reducing morbidity in cardiac and diabetic patients. Now let's talk about itraconazole, an antifungal medication commonly used but with several dose-dependent side effects, such as nausea, vomiting, and other issues when doses exceed 400 milliliters per day. Some of the adverse effects of itraconazole include potassium loss, altered liver function tests, gastrointestinal disorders, diarrhea, and skin rash. More concerning is that there have been reports of itraconazole causing congestive heart failure. The exact mechanism by which itraconazole may lead to heart failure is unknown, and cases have even been reported in patients who were cardiovascularly healthy before taking this medication. Itraconazole is often prescribed for patients with immunosuppressive disorders like HIV and for treating fungal infections such as histoplasmosis, aspergillosis, and others. While itraconazole can potentially cause heart failure in any patient, it is especially important for those with existing cardiovascular problems to avoid its use whenever possible. Finally, let's discuss medications for Crohn's disease. Crohn's disease is a chronic inflammatory condition affecting the gastrointestinal tract. In recent years, several medications have been developed to manage the disease, particularly those that inhibit a substance called tumor necrosis factor, TNF. These drugs, often referred to as biological therapies, are widely used in patients with severe Crohn's disease or ulcerative colitis. Some of the most notable among these are etanercept, infliximab, and adalimumab. Medications administered subcutaneously or intravenously, such as those used in biological therapies, can have significant cardiovascular effects. The most concerning is the potential for worsening previously compensated heart failure or even triggering new heart failure. A comprehensive review that included data from 26 different studies, encompassing over 16,000 patients, found that these medications could increase the risk of heart failure deterioration in up to 25% of treated patients. Although the exact scientific explanation remains unclear, it appears to be related to the biological impact of these treatments. For this reason, patients using these medications for inflammatory diseases should be closely monitored by their healthcare providers. Regular evaluations are necessary to detect any cardiovascular side effects. If such effects are identified, doctors may need to adjust the treatment plan, which could involve altering the dosage, switching to a different medication, or even discontinuing the treatment altogether. Next, let's discuss chemotherapy medications. Chemotherapy is a common treatment for cancer, and while advancements have been made in recent years, one of the major side effects remains cardiotoxicity. This refers to the harmful effects on the heart that many chemotherapy drugs can cause. Despite efforts to develop cancer treatments with reduced cardiac impact, heart-related complications remain a significant concern. A large-scale study revealed that approximately 10% of patients undergoing chemotherapy experienced some form of heart disorder due to their cancer treatment. The exact mechanism by which chemotherapy induces heart failure is still not fully understood, but it is believed to be dose-dependent. Unfortunately, heart failure resulting from chemotherapy is often asymptomatic, meaning patients may be unaware of the damage until more advanced diagnostic tests are conducted. Among the most commonly used chemotherapy drugs are anthracyclines, such as doxorubicin. These medications are particularly known for their potential to cause cardiac issues, making it essential for patients receiving chemotherapy to undergo regular heart function assessments throughout their treatment. Serious heart failure is a significant concern that can often lead to the discontinuation of cancer treatment in many patients. For those undergoing chemotherapy, it is crucial to be closely monitored by their healthcare providers. Regular diagnostic tests should be performed to assess heart function and detect any early signs of deterioration. In some cases, Cardiac medications like diuretics or specific antihypertensives may be prescribed to manage heart failure symptoms. However, it's essential to always consult with your doctor before making any changes to your medication regimen. Next, let's discuss central nervous system medications, including psychiatric drugs such as antidepressants and antipsychotics. These medications have been extensively studied for their cardiovascular effects. Some of the most commonly used drugs in this category, like haloperidol and risperidone, can directly impact the heart by prolonging the QT interval, a critical phase of the heart's electrical activity. Prolongation of this interval increases the risk of arrhythmias, some of which can be severe and potentially fatal, leading to sudden cardiac death. While the incidence of this adverse effect is relatively low in the general population, it becomes more concerning in individuals with pre-existing cardiovascular conditions or congenital heart disease. The risk of arrhythmias is particularly high during the initial stages of treatment, or when there is a sudden cessation of the medication, both of which can trigger acute heart failure. We hope this information has been helpful. Remember to consult your doctor if you experience any symptoms, need to stop taking any of the medications mentioned, or notice any cardiovascular discomfort. All the information provided here is scientifically validated and up to date. Thanks for watching. If you found this video helpful and want to stay informed about the latest health tips and advice, make sure to hit the subscribe button and click the notification bell. By subscribing, you'll be the first to know when we release new content to help you live a healthier, happier life. Don't miss out on our expert-backed insights. Join our community today. See you in the next video.